let's talk about our body's most critical engine, our heart. I mean, it works tirelessly, day in and day out, right? But for something so vital, there's a ton of confusion about what happens when things go wrong. So we're going to dive in and clear all that up. Okay, so right off the bat, let's tackle something you've probably heard a million times. Heart attack, cardiac arrest, are they the same thing? A lot of people use those terms interchangeably, but they are completely different. And knowing that difference, it could literally be life-saving. So, here's our game plan. First, we'll talk about why your heart's job is so critical. Then, what happens when the system fails. After that, we'll decode those warning signs you absolutely need to know. Then, we'll get into how you can take control of your health. And finally, we'll look at the roadmap for modern heart care. All right, section 1, let's really set the stage here. What are the stakes? Why is this conversation so incredibly important right now? Well, it's because of this. Heart disease, it's the #1 cause of death in the United States for people from most backgrounds. That single stark fact really puts into perspective why this matters to every single one of us. Okay, moving on. Let's get our terms straight, because this is where a lot of the confusion happens. When we say heart disease, what are we actually talking about? For a lot of people, it starts right here with something called coronary artery disease, or CAD. It's the most common type. Just imagine the plumbing in your house getting all clogged up with gunk over time. That's basically what this is. The arteries feeding your heart get narrow, and that becomes the root of so many other problems. And then there's the term heart failure. Now, this one is super important to get right. It does not mean your heart has just stopped working. Nope. It means the heart muscle has gotten weaker and it's struggling to pump blood as efficiently as your body needs it to. And that brings us right back to where we started. Remember that question? Well, here is the answer, and it's actually pretty simple. The American Heart Association puts it perfectly. A heart attack is a circulation problem. That plumbing we talked about, it gets a total blockage. But a cardiac arrest, that's an electrical problem. The heart's wiring goes haywire, and it just stops beating. They're two totally different things, even though one can sometimes lead to the other. Okay, so knowing the definitions is one thing, but recognizing your body's emergency signals in the real world, that's a whole different ballgame. So let's talk about those warning signs. You know, we've all seen it in the movies, right? The classic Hollywood heart attack. Someone dramatically clutches their chest, they complain about pain shooting down their arm, they're short of breath, and yeah, those are absolutely real classic symptoms. But is that it? Is that the whole story? Not even close. And this is where things get really, really important. The symptoms can be totally different depending on who you are. For women, it might feel less like chest pain and more like extreme, unusual fatigue, nausea, or this weird pressure in the upper back, like a rope is being tightened. And for older folks, a heart attack can be completely silent with no chest pain at all. Knowing this stuff is absolutely crucial. And if you're wondering just how urgent this is, think about this. A heart attack isn't some rare thing. It happens in the US about every 40 seconds. Every 40 seconds. That's why spotting those signals, even the quiet ones, is so important. Okay, so that's the scary part. But we're not just here to talk about problems, we're here to talk about solutions. So let's flip the script and talk about what you can actually do to take control. So, based on what experts say, it really comes down to these 5 key things. Get your body moving, fuel your engine with good stuff, try to manage your stress, and please get enough sleep. Ditch the bad habits like smoking, and this one's huge. Know your numbers. Get your blood pressure and cholesterol checked. These are your tools for prevention. And hey, if you ever think those small changes don't add up, check this out. For every kilogram, that's about 2.2 pounds of weight you lose, your blood pressure can drop by about 1 point. It just goes to show you that those little consistent efforts, they make a huge, measurable difference. But look, what if prevention isn't enough or a problem is already there? Well, the good news is that the way we treat heart issues today is incredibly advanced. There's a real path to treatment and recovery. Okay, whoa, this looks super complicated, right? Don't even try to read it. That's not the point. The point is to just see how detailed this is. This shows that doctors today have these incredibly sophisticated roadmaps to figure out the best treatment for each individual person. It is not a one-size-fits-all deal anymore. And that whole roadmap, it's really built on these 4 main pillars. It all starts with lifestyle changes. That's the foundation. Then you've got amazing medications, advanced procedures and devices when they're needed, and finally, cardiac rehab to help people get their strength back. It's a full-on, comprehensive strategy. So let's just end on this thought. Your heart is working for you 24/7. It never stops. So the question is, what's one thing, just one small change that you can do for it starting today?